help manage some of the difficult behaviors. Okay. We're going to look at behavioral ways in which to manage this. We're going to look at how to structure the environment. We're going to look at physical supports. We're going to look at medications. And we're going to look at how you respond as caregivers. So, individualized management strategies. Again, across the bottom, those are all the different ways in which we're going to structure how we approach and manage behaviors. The first thing is to consider the whole picture. You really need to sit back instead of just looking at one kind of thing that's happening, and look at the big picture and to begin to look for patterns in the person's behavior or when do things happen at a particular time of day, because there are things that may be contributing to the way behaviors are playing out, but you won't identify that until you begin to really look at what's happening, and is it happening particularly over time or at the same time. You can do this really by keeping a log or a record. You know that you see something happening, and if you really start to log this over a week's time, you might be able to find the cues that can help manage it, so that you can adjust those strategies and plan for it so you can prevent the incidents from occurring or the behavior from occurring. Examples of behavioral strategies are: use simple words, yes, no, or instead of questions, so that instead of offering, gee, do you want to go to, do you want to go outside today? Offering options to say, let's go outside for a walk just to get out of the house. Offer, so that not giving the space where the person has to think through making a decision, because they either lack the capacity to do that, or they become anxious because internally they can't think it through. Frequently people become anxious because their normal way of being has been disrupted. You can imagine that if you are normally a flexible thinker, and you're used to being independent and you're making decisions, and people are asking you to think like you did before, but it's missing. Something's missing. Like when you meet somebody and you can't remember what their name is, and you're socially awkward and you're anxious now because I'm supposed to know who they are. You can imagine the same thing happens when people are placed in a situation where they have to think through a situation, and they go to use their brain to do that, and it's not there. Or it's there in a different way, or it's slower. They become anxious. And they can't. Or they become defensive, or they become angry. So not placing them in a situation where they're forced to think through a complex task, but rather offering them a directive option. Praise desired behaviors, so that if somebody is consistent in using a suction or a device or their walker, look at that, you're not falling today. Look at that, you had a great day today. You didn't wake up last night because you used your nebulizer before you went to bed. Find soothing rituals. The research shows us that things like hand massage, favorite music, time with a pet, things that offer calming reassurance, that activate those parts of the brain, actually help to provide and help soothe people. Avoid arguing, change the subject, because when you engage like this with what your attempts to logically help somebody do something, this is what happens. Everybody do this. Pull. One side let go. What happens? So the challenge is this person can't let go. They're stuck in fixing. You want them to do what you want them to do too. But if you, who are still thinking, can let go, it let goes. Our tendency is to do this. That's tough to learn, but a good, what works. Find a walking buddy for restless times during the day for the other person. You need a break. So you need people to engage them with frequent, and what we sometimes see as frequent repetitive behaviors. And engaging them in physical activities, whether it's walking, whether it's watching something on TV, whether it's something that can help focus their anxiety and their behaviors. An environmental strategy is to create a structured, predictable daily routine. Think of what provided security to a toddler. They woke up, they knew that this was going to happen, they didn't have to think about it. They didn't have to plan their day. So that if you create a structured, repetitive pattern to replace what adults now do, they're much more secure in what's happening. It helps with apathy, in meaning that it engages people, but it also helps with people who are disinhibited and who get distracted and can't organize their thoughts and their behaviors. It helps with people who have difficulty sleeping, if you can help create rhythms. It takes the pressure of decision-making off the patient. Here are some tips. Match activities to the person's abilities. So, they may have been able to go on walks 6 months ago. Now they aren't able to do that, but you might find a knitting activity or activity that matches their physical function or their capacity. And individualize the routine to the patient's likes and interests. Our patients get fatigued. Before they used to be up at 6 a.m. Now they sleep till 10. That's okay. So help to readapt a routine around what is supportive to them. We'll talk about that later. These are environmental strategies. Monitor the person's contact with the outside world. These are particularly important strategies because people lose the ability to set protective structures in place. So it may sound like this is the kind of things that you would do for somebody who is, you wouldn't leave somebody alone if they were 7 years old. But you have an adult who has now lost the capacity to protect themselves. We have many instances where people have come to the door, they let them in. They may be strangers, they may be salesmen who come in and the person is now compromised. They lose the ability to screen themselves for safety. And so that they use connections, internet, the telephone, watching TV, and responding to 1-800 calls for charity donations, for spending their money. All of those sorts of internal sensible monitoring that people do to protect themselves are filtered and are gone. I think that one of the earliest things that we found that we were missing in telling people is how to have to really put safeties in place for people financially, because they really lose that. Not all people, but many of our patients. And so that we have found that many of our patients have been scammed. They've lost the capacity to monitor their own spending. They've opened charge cards. And family members retrospectively have found new charge cards that have been opened, scams that have been done, thousands, tens of thousands, hundreds of thousands of dollars that have been lost, or placed family members in debt because these were unknown things that were happening, because assumptions were made that they were able to manage themselves, and these were, and we can talk more about this later, but I think we can't emphasize the concern that we have for family members around finances and their ability to manage things. So we can talk about how to actually work through that. Other environmental strategies are to keep out of sight and limit access to the things that people aren't able to do. Managing car keys. You can't tell somebody who's been driving all their life and don't think that there are changes, that just don't drive. They'll go out and drive. So it may mean limiting access to a car, removing car keys, or sometimes removing the car. Removing sources of power tools, guns and firearms, medications, or unsafe foods. Family members will say to us, well, they really like candy and they can't swallow. Well, you need to not buy it and not put it in the house, but they want it. I know they want it, but you have to physically just remove it and be firm about that. Physical interventions. Looking at different ways to communicate. Creating picture boards if the temporal lobe or the language components are involved. Using hand massage to encourage eating because that helps soothe, and also there's been research done that actually can enhance people's ability to focus and eat. Looking at locking doors or putting physical barriers in place so people don't wander or leave the house. Looking at ways to avoid physical restraint. Sometimes, people really get engaged in behaviors where they think that, oh, well, we'll just physically restrain them. But to actually look at the physical environment so that you may say, well, we're going to keep them in this area, in this part of the house on the first floor. Example, well, they always want to go to the basement to do the laundry. Well, it's not safe to go to the basement. That means that you may have to devise a lock system from the other side so that the person can't get access to the basement because they can't make a decision that going down the stairs to do the laundry is not safe anymore. So you really have to look at physically putting things into place that will keep them safe. Adjust sounds, lighting to also limit agitation. There are some medications that we might think about. Specifically, there are no medications to cure frontotemporal dementia. However, some medications may be effective to help with either agitation or irritability. And we also want to consider and treat depression. Depression is a separate thing that can happen. People with frontotemporal dementia or cognitive changes may also have depression. And we have found that treating depression may actually help to manage some of the behavior. We have found that it may be necessary to get a psychiatric consult because some of the medications involved for particularly agitated behavior might better be managed with a combination of pharmacotherapies that are really outside the scope of a general neurologist. And lastly, caregiver responses. How can we help you change how you respond to what's happening? Remember that these changes are not the fault of somebody. We frequently, our internal responses are, if they would only do this. Because that's how we think. If they would only do this, then that would happen. But that, we have to recognize that they're not doing that because they just don't understand or they're just not thinking because they aren't. So we have to change how we view the situation. We have to recognize that we have to work to accept that these are physical changes that have occurred in the way the person thinks. We should recognize that information helps empower us to look at this differently and to plan differently, and we're going to give you resources for that. Seek out support from others. Reassurance that there are ways through this situation. Support for yourself that this is difficult and that you need others helping you, that you can't do this by yourself. The demands on a caregiver for someone with these kinds of behaviors are more than one person can do 24/7, and that you also need to take care of yourself. You are at the highest risk for stress, higher than people with Alzheimer's disease and higher than people with ALS, because you are dealing with both cognitive and physical domains. We recognize that depression, anxiety, anger, guilt, frustration, irritability, and resentment are what caregivers experience. Those are the emotions that come forward for our caregivers as you're struggling to deal with this. We know that people become physically ill, that they don't sleep, and that they feel isolated. That who do I talk to about this? ALS is bad enough There's nobody out there that knows about ALS, let alone ALS, but also with cognitive changes. There's not only a stigma associated with physical disease, but there's even a greater stigma associated with cognitive disease. And so that how do we deal with the fact that this person not only is physically isolated, but that now they're not thinking correctly. And caregivers get burned out and they can't do this anymore. So we're trying to recognize that this is what will happen to you, so that we want you to help plan so that you're safe. So some caregivers' self-care techniques are making planned regular breaks. So that means that not only planning for the person's day, but to plan for when you're off and away and downtime. That you really need to say, okay, when am I going to be away from this and what am I going to be doing? Even if just for a few moments. You need to look for multiple friends and family members to provide support and coverage. There is the use of either in-home care or respite care by bringing other people in from agencies. Some of our patients actually have been enrolled in adult daycare programs, and we have found this really, really helpful because it gives them structure, it gives them a place to socialize, and it gives them safety and confinement. So some of our patients really have flourished in an adult daycare environment. A long-term care placement for some family members may be necessary or an option, and hospice care is available. So that there are different ways at different places that you can plan to add support and caregiving. Other self-care techniques include relaxation, breathing techniques, the kinds of things that provide internal support, such as prayer and meditation, reading, journaling, and don't forget for you to eat too. Because people get to the end of the day and they recognize that they haven't planned for the regular watering and feeding that we look to provide other people. We know that when our family members are not sleeping and in cognitive changes, sometimes it's very difficult for people to sleep. They may be up all night and their sleep patterns are disturbed. We want to look at ways that you can sleep also. So that if they're not sleeping, you're not sleeping. And so that's why we're assessing, are they sleeping? We're knowing, because we've got to get them sleeping so you can sleep. Look at focusing on improving your sleep by looking at ways that you can try to sleep, but also be aware if they are up and about or needing attention. On our caregiver forms, we ask you, are you seeing your doctor? Is your doctor aware that you're a caregiver? Because we know that we want you involved and connected with your own healthcare providers so that they can manage and help you. We want to see if you're depressed, because depression occurs for caregivers, and we encourage you to manage your health because we know that you are at risk for these problems. Stay connected to other people. And know that there are resource groups available not only for ALS, but also for frontotemporal dementia and cognitive changes, where you can talk to others about how they're managing that. So the take-home points are, develop a toolkit for yourself with different approaches, because different problems are going to occur. Medications may help with some behaviors, but won't cure ALS and cognitive changes. And remember to care for yourself at these challenges.